So, welcome everybody. In this video, we'll learn about conjunctival examination. So, when you're examining conjunctiva, what are the things that you're looking for, and what are the abnormal things that you will see, and when you see them, how do you identify them? What could be the causes? What are the common questions asked during conjunctival when you're presenting conjunctival examination? Okay. First is anatomy. First, you need, I'm not going to go into detail about anatomy here because it's more of a clinical examination. You need to know that conjunctiva has three parts: a semi-transparent mucous membrane, which covers the lid, extending from the lid margin to the limbus. Okay, from on both sides, from the lower lid margin to the fornix to the limbus, and it also goes in the same way in the upper lid margin to the fornix and to the limbus on the cornea. Now, there are three parts to the conjunctiva: the bulbar part, which covers the globe or the bulb of the eyeball, and the palpebral part, which covers the lid. Okay, palpebra or the lid. So the conjunctiva covering along the lid on the posterior surface of the lid is called the palpebral conjunctiva. The conjunctiva covering the globe, okay, is called the bulbar conjunctiva, and in between these two, bulbar and palpebral conjunctiva, is called the fornicial conjunctiva or the fornix. So you have to examine all three before you say it is normal. Now, bulbar conjunctiva is very easy to see. When you see the eyes, you will see it. And to look at the upper bulbar conjunctiva, probably you have to just lift the upper lid. To look at the lower part of the bulbar conjunctiva, pull down the lower lid. Lower palpebral conjunctiva is also very easy to examine. Just pull the lower lid, you will see the lower palpebral conjunctiva. And fornix also is easy to examine. But how will you examine the upper palpebral conjunctiva and the superior fornix? So for that, you need to do something called as eversion and double eversion. Eversion, single eversion to look at the upper palpebral conjunctiva, and double eversion to look at the fornix. Now we'll see how we do it. Now here we're seeing the superior, one eversion, we see the superior palpebral conjunctiva. And now to look at the superior fornix, we use a Desmarais lid retractor and retract the lid. Okay. So if you retract the upper lid, double with the Desmarais lid retractor, you will see the superior fornix. Okay, this is superior one eversion, so palpebral conjunctiva, and to look at the superior fornix, you will do the double eversion using a Desmarais lid retractor. Okay, where do you examine superior fornix? Not in every case that in a normal case you'll go ahead and examine the superior fornix. Only when there's foreign body fall into the eye or chemical injury, you have to do. The examination is incomplete if you don't do it. But in a case which is you're not suspecting any foreign body, you don't have to do the double eversion and look at the superior fornix. But in these two cases, the examination is not complete unless you've examined the superior fornix. Okay. Now, what are the other conjunctival signs that you will see in diseases, and what are the things that you will examine? First is the color. Okay, the conjunctiva, normal conjunctiva is thin, semi-transparent structure, fine, which has fine network of blood vessels. Okay, can you see discoloration in the conjunctiva? Yes, if there's a conjunctival nevus, okay, you can see discoloration of the conjunctiva. What is this? Argyrosis. Earlier, they used to use silver nitrate in newborns, they used to use silver nitrate as soon as they're born, to clean or to disinfect the surface. So this used to result in argyrosis. This is no longer, is used to cause chemical conjunctivitis and also discoloration of the conjunctiva. This is no longer used now. Or you can see reddish discoloration of the conjunctiva. This is usually because of subconjunctival hemorrhage. There's a bleed under the conjunctiva. You can see this reddish, well-defined, diffuse pattern, red blotch on the conjunctiva, which does not have any blood vessels, are not seen or prominently seen. It just looks like a subconjunctival bleed, that is subconjunctival hemorrhage. Now, what else will you examine in conjunctiva? Congestion. This is the most common thing that you will see in conjunctiva, that is congestion of the conjunctival blood vessels, which can be superficial or deep. What do I mean by superficial or deep? When the conjunctival blood vessels are dilated, the conjunctival blood vessels are branching, dichotomously branching blood vessels. When these are congested, we call it as superficial conjunctival congestion. Okay. Now, when the deep vessels are congested, these are not, you see the congestion in the conjunctiva, but then these are deep blood vessels or the ciliary, deep ciliary vessels, and these are usually around the cornea. That's why we call it as circumcorneal or ciliary congestion. Okay, so you need to differentiate. Both of them will look like red eye to the patient, and the patient will come with the presentation as red eye. You need to differentiate whether it is superficial congestion, because the diagnosis is different. When you see superficial congestion, it's most commonly conjunctivitis. But when you see deep congestion, where here you see that the periphery is normal, right? The periphery, I mean, near the fornix, the conjunctival blood vessels are not even congested or dilated, whereas they're more congested around the cornea. So that means the deeper blood vessels are congested. When do the deep ciliary vessels become congested? Whenever there is any inflammation on the inner aspect, that is, whenever there's inflammation of the deeper vessels, that is in the iris, which are congested, which can happen in case of iridocyclitis, anterior uveitis otherwise, or keratitis. As you see in this case, again there can be anterior uveitis resulting in a congestion of the deep blood vessels, or acute angle closure glaucoma. So whenever you see deep congestion, whenever you see circumcorneal congestion, your diagnosis will be more of iridocyclitis, keratitis, or acute angle closure glaucoma. But when you see superficial congestion like this, your diagnosis will be conjunctivitis. But I mean, sometimes you can see both superficial and deep, like in case of fungal keratitis. I mean, any bacterial keratitis also, corneal ulcer, you will see both. You will see both conjunctival congestion and deep ciliary congestion. So you have to be aware and you have to identify them. Now, how do you differentiate these two? Now, just saying the causes is not enough. You have to be able to differentiate. This can be one of the questions that will be asked. How do you differentiate between superficial and deep conjunctival congestion? So, first is the site. It's conjunctival, superficial congestion is, or conjunctival congestion is more marked in the fornix. It's all from the fornix to the limbus, all the blood vessels are dilated and congested. The redness is throughout. Whereas here it is more marked around the limbus, and it's less as you go through towards the fornix, it's less or almost not there. What is the color? Since it's a superficial conjunctival blood vessels, it's more bright red, whereas in circumcorneal congestion is deep red because the deeper blood vessels. Arrangement of the vessels. In case of conjunctivitis or superficial congestion, the blood vessels are arranged in a branching pattern or a dichotomous. There, the blood vessels are branched. Whereas what you see in case of deep congestion, you see that these are radiating from the limbus and they are straight. They're deep, they're radiating from the limbus and they're straight. They're not branching. Okay, that's how you identify the arrangement of the blood vessels. On moving the conjunctiva, if I move the conjunctiva, I use a cotton bud and move the conjunctiva, these congested vessels move because they're in the conjunctiva. Conjunctiva moves, right? Whereas these blood vessels are in the deeper episclera. They do not move when you move the conjunctiva. On applying pressure, if I put pressure on the conjunctiva and release it, how will the blood flow be? It will always be from the fornix towards the limbus. The vessels will slowly from the fornix towards the limbus. Here in deep vessels, deep congestion, the vessels fill rapidly from the limbus towards the fornix. On applying phenylephrine, phenylephrine is a vasoconstrictor. On applying phenylephrine, vessels blanch immediately in case of superficial conjunctival congestion. Whereas in deep vessels, they do not blanch. You will still see, even after you put phenylephrine, the congestion remains. So, First, you'll mention about the color. If it is normal, then you look for any congestion. Congestion, if it is present, you'll differentiate between whether it's superficial or deep. The next is chemosis. What is chemosis? Is nothing but conjunctival edema. So here you see that the conjunctiva looks ballooned out with fluid. There's no congestion, but there's only conjunctival edema. This most often you'll see in allergic conjunctivitis, but you can also expect sometimes you can see both congestion and chemosis. So you have to, if you see both, you have to write both chemosis present and conjunctival congestion also present. The next thing that we see is presence of follicles and papillae. What are these follicles and papillae? These are most commonly seen in palpable conjunctiva. Now, follicles, these are follicles which are whitish or otherwise described as sago grain appearance, okay, on the palpable conjunctiva. And papillae are otherwise described as cobblestone appearance, okay. What are follicles? These are nothing but lymphocyte accumulation, like follicles anywhere in the body, right? Lymphocyte accumulate aggregates under the in the subconjunctival tissue is called as follicles, okay. Whereas papillae, it's a vascular front, okay, in the center. Where in follicles you have in the center it is whitish and surrounding is red, okay. The circumferential congestion around the follicle, whereas in papillae the center is has a blood vessel, and so the center is red and the surrounding area is more of fibrosis, so the surrounding area is more whitish, okay. You have to remember that when you're identifying, when you see follicles or papillae in the palpable conjunctiva, you have to differentiate whether it's a follicle or a papillae. What are the causes of follicles? It could be trachoma, acute follicular conjunctivitis, which can be either bacterial or viral, chronic follicular conjunctivitis, or benign school folliculosis, where you see follicles. In papillae, most often seen in allergic conjunctivitis, but of course they can also be seen in trachoma, vernal keratoconjunctivitis, or spring catarrh, giant papillary conjunctivitis. Usually, papillae are seen most often in allergic conjunctivitis, and follicles are most often seen in infectious conditions. But of course, you can see follicles and papillae in either of the either of the cause. Now, for what is the next thing that you would look for conjunctiva is foreign body. If the patient comes to you with foreign body sensation, you have to look at the bulbar conjunctiva. You have to avert the upper lid. Usually, the foreign body most often gets, after it enters, there's a depression in the superior palpable conjunctiva, which is called as sulcus subtarsalis. It goes and gets lodged in this situation in this place. So it's very important when a patient comes to you with foreign body sensation or a fall of foreign body into the eye, you have to avert the upper lid and see. It can be anywhere. It can be in the fornix. Any chemical injury, you have to do the double elevation and look in the fornix also. Okay. Then you will look for any swellings or tumors in the conjunctiva, which could be retention cysts, like cystic lesions, or it could be ocular surface squamous neoplasia, which is more often at the limbus, or limbal tumors. These can also be seen in the conjunctiva. Then last one is symblepharon. That is, if you see there's an attachment between the bulbar conjunctiva and the palpable conjunctiva following chemical injuries, or Steven Johnson syndrome, or any ocular mucus pemphigoid. Uh, so these you can see symblepharons in these conditions. The last thing that you would look for is conjunctival degeneration, which is very common. A white pingicula is a yellowish deposit at the limbus, which does not cross the limbus. It does not encroach the cornea, and is yellowish, usually cholesterol deposits on in the conjunctiva. And pterygium is a subconjunctival elastotic degeneration which encroaches on the cornea. We will learn about pterygium in another video. Here, you just identify when you're looking at conjunctiva, you will just mention these things. You, of course, when if there's a pterygium case, you will not just mention pterygium present. You will describe it as a wing-shaped lesion encroaching from the caruncle, extending onto the cornea around 4 mm, which is looking fleshy, vascular, or looking atrophic, You will describe it and then suggestive of pterygium. That's how you will describe it as. Okay. So in summary, you will examine the bulbar and palpable conjunctiva in all the patients. You will examine the inferior pharyngeal conjunctiva can be examined easily, but superior pharynx is examined only when there's an indication, when there's a chemical injury or a foreign body. Only then you will examine. Otherwise, you don't have to examine superior pharynx in every case. And as for any other or every other structure, if you find any abnormality, you describe it. Otherwise, you will describe the conjunctiva as bulbar conjunctiva and palpable conjunctiva are normal. So the next thing, if you tell phonics is also normal, the next question will be, the examiner will ask you, how will you examine the phonics? You will be telling that this inferior phonics can be easily examined by pulling down the lower lid, but superior phonics you need to do double eversion using Desmarais lid retractor. So you will examine the color, then the congestion, and if there are any follicles or papillae, if there are any foreign bodies, then you will look for symblepharon, and you will, if they're present, you will describe it. And then and last one is corneal degenerations. If it is not, if they're not present, then you will only say it is normal. Thank you very much.